Hello, everyone, and welcome to another episode of DEO Growth Secrets. I'm your fearless host, Emmett Scott, and today I've got Clay Griffith, who is the head of marketing and growth for Advanced Dentistry, which is a four-office dental group practice group in Ohio, and then and also you're with Vesper Institute, which we're going to go a lot into what Vesper does and the huge leverage and help it's bringing to the industry. And I also have Leah Zipperstein here, who's head of strategy at Vesper Institute. So thrilled to have both of you. And I'd love to just dive right in because anytime someone's in the education realm, coaching realm, et cetera, one of the unique things we have is we're meeting with a lot of people in the industry, mostly with practice owners. And you just start to see patterns. You start to see what's working, what's not working. So, I mean, before we get into like the details of Vesper, I'd love to hear what you all just see happening in the industry. Of course, there was kind of this pre-COVID world and post-COVID world. For better or worse, it is what it is. It has changed. And I'm curious just what, yeah, where are things going? Where is the emphasis? Where are the problems different than they used to be before? And what are the solutions people are trying to solve?
Yeah, that's a great place to start. First of all, we're pumped. I'll speak for both of us, speak for myself. We are pumped to be here. Thanks for having us. It'll be fun. Rapping with
So
you.
great to have you.
Long-time listener, first-time caller. um, I'll let Leah kind of hop in. She's got, great kind of like clean thought patterns that are really fun to listen to. So just by way of saying thanks for letting us have us here. Tee up, Leah.
Good to have you, Clay. Yeah, go ahead, Leah.
Yeah, thanks. Also very excited to be on. And I think for dentists, really for anybody in any industry, it feels harder, especially post-COVID. I think you've got staff who expect more out of you, you've got customers who expect more, and you don't have the time and energy to give that feels like it's more. You thought and you think, and you probably are doing a really great job exerting yourself, putting it all in, thinking about the business, even when you're not at work, but it's harder. And so in particular, what does that look like for dentists? I think we'd break it into three categories. There's patients. You've got the patient challenge, and oftentimes that's high fear and anxiety. So as soon as they come to your office, probably what is something you've heard? I don't want to be here. I hate the dentist. I'm afraid of the dentist. How common is that? And how kind of mentally, almost debilitating would that be as a dentist who's just trying to provide good care, or your staff who's just trying to provide good care, but that's the refrain that you continually hear. Or your schedule falls apart because the patient was so afraid they couldn't even show up to the appointment. You see they have all this treatment that they need. You come up with a really good treatment plan and they say no. So that's on, the patient side and what the patient is feeling. Then how does that relate down? Staff. There's so much churn and burn. I think somebody who started to practice 30 years ago, you ideally had good staff. And if somebody left, that's not ideal, but you could find somebody to replace them. There's a huge hygiene shortage right now. You feel like you can't lose anybody because you've got nowhere to turn, and your staff's unfortunately not feeling good. They're feeling spread thin. Their patients feel frustrated. There's very chaotic schedules. So that is really, really challenging. It's hard to attract staff. It's hard to keep good staff. And because of that, then you as the dentist are feeling incredibly frustrated. You went into this profession to try to help people, and you are, but that's not what is being, verbalized or reciprocated from sometimes your patients and your staff. So I think you might be wondering, like, is this as good as it gets? Why did I pick this job? Could I be anything else? You're very busy. You've got high volume, low revenue cases. And then all of that boils down to that financial pressure, the stress of like, am I going to make ends meet? This can be a very lucrative profession, and that's not why you should go into it, but that is a nice upside and benefit that we'll talk about more. But when you've got, patients who aren't showing up, insurance that's nickel and diming you, staff who's asking you to get paid more, or you're running a crazy schedule, it all adds up to being like, I'm not sure I can handle this. And that's a really tricky place to be for dentists right now, which is why, a DSO option can maybe be appealing and nothing wrong with that. But if you're the dentist who wants to take ownership, and I think, those on a DEO podcast, they want to feel like they've got a handle on the business and the clinical. We do want to say it's not all doom and gloom. We've got a solution that we've seen, works on our side, may or may not be the right fit for you, but there can be hope ahead on the dental landscape, even with these current challenges.
I think one of the things that you call out is the fear piece. I mean, that's always existed. It's always been a friction point, as a non-clinician and kind of all of us with a little bit of a marketing brain, we know that dentistry is not the same as like giving out iPhones, we're not getting a big line and like, guess what, guys, I've got my root canal today. Isn't this, awesome? In fact, we have idioms in English that when we're describing something painful, we use dentistry, right? It is like getting a root canal. It's like pulling teeth. It's like, right? So we are working against those friction points. And I think when the supply demand curve is such that it's like, well, I got enough patients and things are working out, maybe we don't really care about that reality. But when things aren't, we do have to kind of get back to the roots of marketing and sales and how are we going to reduce the friction points? Simple things like people want more convenience than ever because of the Amazon effect, right? So if you don't have online scheduling, that's a friction point, right? That you're creating. So this fear one is really interesting because I just think it's always there. And it's something I think specifically you guys are really hitting on in a unique way on scale, So can you talk a little bit about how you address that component and how you think about that?
Definitely.
Yeah.
You want to kick it off, Clay?
Yeah, I mean, zooming really far out, and this is kind of typically comes up whenever we talk. So I kind of just go ahead and tee it up, and we can reference it later. In our minds, yeah, it's just like this universal thing. It's this age old. Everybody doesn't like the dentist. It's not going to go anywhere. So Leah and I often like really force ourselves to come with questions, rather than just like solution first, go. As how can we really get a good, solid, healthy question around this that pushes us, that pushes us, that pushes us. So what? And Dr. Sayer, who's he's been on podcast before, lovely gentleman, founder of both Vesper Institute and Advanced Dentistry, talks on this all the time. So it's really kind of part of like Vesper's and Advanced Dentistry's DNA. So kind of everybody who's listening, you can picture in your head. Everybody's watching, you can watch my hands. Picture like a nice.
Well, Clay, by the way, your video just turned off. I don't know if you want to throw that back up there, and then we can watch your hand. There you go. Now you're back. Yeah.
Yeah, now you're back.
For those on our YouTube who are watching on YouTube. Yeah. Go ahead.
There we go. So picture like a nice old school pie chart, right? Divide it simply in half, 50-50. This really kind of comes into when you talk about like, blue ocean dentistry and stuff like that. Let's talk about the red half. So not the blue ocean side, get the half. This half over here is generally right around half of our American population is comprised of people who are behaving quote unquote as they should. They're taking care of their dental hygiene. They're going every 6 months, maybe not every 6 months, but they're going regularly. They're doing the things that they've been raised and told that are effective to do. Brushing, all the things, right? That right there, that 50% in your mind, let's call it that red. That is red because almost all dentists are competing for that. That's about half the population. Now let's go ahead and take our eyes over here. The other half of the pie, let's call that blue. Okay, why is it blue? Because no one's really talking to that. And it's still 50% of the American population. Right around 50% of the American population is comprised of people who are not regularly seeking dental care for a whole host of reasons, anywhere from they're somewhere on this fear spectrum, whether they're full-on phobic and hyperventilate on the phone, which happens all day, every day. I listen to the calls, and they haven't been in for 5, 10, 15, 20, 25 years, happens every day in all of our locations. Or maybe it's not fear. Maybe it's they're medically compromised or have a special need, or maybe it's an extreme gagger or an obese patient who needs a special chair. All these reasons add up to the door. Picture, especially metaphors now. Picture a door that a patient can go in. A traditional dentist has this size door. maybe this doesn't fit for all the different patients. If you can expand the size of the door and help more people enter, oh, I can walk through that door. That door can fit me. Yeah, I'm a special needs. That can fit me. I'm medically compromised. That can fit me. Now you're talking to this 50% of the population that no one else is. And so if you're the 1% of dentists that's talking to that 50% of the population, yeah, now you can say, I get you're scared. There's nothing wrong with being scared. That's a human condition. I was once scared too. My dad was scared. I was raised in a scared family. And here's how we're going to solve this. Yes, you're going to hear Leah and Clay talk about IV sedation as a path toward that, but there's many, many, many ways to slice that cake. As long as you're coming from a place of genuine acknowledgement, saying, yes, you're not wrong. There's nothing wrong with you. And guess what? You're not alone. There's a lot of people who need somebody to say, I can help you. And that's Advanced Dentistry and Vesper Institute. We'll talk more about that. But that's the general foundation of kind of how we approach it.
Yeah, and I think your numbers are pretty close to what we see with ADA and ADSO, who've done some stats, 50% of people, maybe 40%, but either way, aren't going to the dentist on a regular basis at all. And if you think about that, when you think about cell phones that have a market penetration of like 110%, right? Because some people have more than one, and we're at 50% market penetration in dentistry. In theory, you could double the entire industry if you could address that second half. So when people say things like, hey, are you concerned about DSOs? Are you concerned about, I'm like, there's an entire set of market that no one's even addressed yet. So much opportunity. And I think that's what you all are hitting on. So let's talk through IV sedation, and it can feel intimidating for a dentist, maybe complex. You all are really set to try to simplify this and make this, I don't want to use the word norm if that's the wrong word, but make it a systematic for dentists to be able to use and feel the confidence to use and to solve the fear side of this equation. So Leah, can you talk a little bit about that and why you guys have gone that route?
Sure. Yeah, I think fear is, such a theme for this because patients are fearful, so they won't see the dentist. They could benefit from IV sedation. Dentists are fearful to implement IV sedation. Vesper Institute exists in the middle, knowing patients need it and want it. Dentists are fearful to offer it. Can we provide training that closes that gap? So we're taking care of more patients, and we're giving, students, dental students in our program at least, the confidence and competence to go practice this safely. And so it is just safety, safety, safety is the most important thing. It's a mindset. I mean, imagine if you went the first year you're in dental school, the first year in the clinic, and you're handed the drill. I'd like to think most people were a little fearful that first time they're drilling into a tooth. I would hope so. And now it's second nature. So as with anything, when it is new, it is scary. With the right training and the right attitude, you gain the confidence so that it can become second nature. And our faculty is really, really good about this because the mentality isn't if there's going to be a medical emergency, sedation related or not, it's when. They don't, as I say, they don't schedule appointments. So IV sedation aside, I think it's really important for dentists to not feel as though like everything is hunky-dory without IV sedation and they're comfortable. Safety's got to be important day in and day out, whether you're doing a sedation-related procedure. If you tack on IV sedation, then you are going to be at the top. You're not relying on somebody else to come in and handle it. You're going to know how to handle it. So with that, first, just really important mindset. Not to say snap of the finger, you're good to go, but if you can adopt that, then I think you start to chip away at your fear as the practitioner implementing IV sedation. And in our program, that's where it starts, just understanding it, recognizing it, and then giving you the training, which is mock drills. We have a really great sim lab with kind of this high fidelity mannequin inside our didactic training where you're running like, what would feel like a real life emergency and getting to navigate that. Also understanding scope. If you're starting off doing IV sedation in your first or second year, what's the type of case and treatment that you would feel comfortable with? And where should you not go? And having access to faculty to be able to ask that question beyond the gates of our program. we don't want to say you finished the program, best of luck to you. You finished the program, and we expect and encourage you to, call the faculty and say, hey, I've got this upcoming case. How would you handle it? What should I be on the lookout for? So that is first and foremost. You just got to acknowledge it. And once you own that, our training is built around ensuring that you're, confident and safe.
Leah, when you were laying that out, where you say the customer really wants this and it's logistically complex, right? I.e., someone could get hurt, die, etc., and there's a lot of fear around that. Those two elements are always what creates competitive advantage.
Yeah.
Right. So if you think about Amazon, it's like, hey, I've got this low cost book that I want to be able to deliver within same day and still be profitable. That's a logistical problem that most people didn't want to solve. It's played out okay for Amazon to figure that out.
Yeah.
And it created entire markets because of that. And so I think from whether you decide to do IV sedation or not, what's great about these podcasts is the underlying principles are still the same. Looking for opportunities in your marketplace where other clinicians are saying, but that's really hard. It's really hard to do same day treatment. It's really hard to be friendly here. It's really hard to train the staff to do X, Y, and Z, is also where the competitive advantage exists so that you are not just a commoditized element. And as much as I think most clinicians say, well, I just do good dentistry, the problem is that as the consumer, that's actually just a standard I expect, and you could argue like the guy down the street isn't as good, but I don't know, first of all, how to identify that. I don't know what margins are and how to see. I just expect that Amazon delivers me the book appropriately and calls it good. I don't think this delivery system's better than that, other than it's around convenience, etc. So anyway, all that being said, I think it's a really cool principle you pulled out, which is where fear meets client really wants this, patient really wants this, is where some cool competitive advantage. Now, the next part that you hit on is then you have to be systematic and not Harry-Carry about solving that, right? So the other extreme was like, oh, well, if the customer wants it, who cares? Let me watch a YouTube video and let's go. Now, what is going to be your systematic approach to make sure that these logistics are really nailed down? And I think that's where you're saying Vesper comes in, is to bridge that gap around quality.
Yeah, I think there's two components that, and you kind of just, outline them again, Emmett. Like there's two components of the fears. Like, am I clinically, do I have this in my natural, genuine appetite to bite this off and do this clinically? Second fear is, am I going to plunk down all this, training, registration fee and time away from, what I'm doing to learn more? Am I actually going to be able to implement? And that is a very, very founded fear historically. And I'm sure they're kind of like, these numbers are probably updating as we speak, but historically, the literature has not been rosy on doctors who get trained in IV sedation actually implementing it. And that's kind of why we're here. That's one of the kickstarts of why we're here, because that's not great. We don't want that. For those of us who kind of been living in the dream of doing it, seeing the numbers of people who aren't able to actually implement it in real life, it stings. Like, well, let's get out there and help. To be honest with you.
Yeah.
And the numbers that I'm referencing there is, I think it's 86, 85 or so, 86%. This is Malamed's book. 86% of docs who are trained in IV sedation end up not implementing it. They don't operate it. It just ends up withering on the vine because it's really hard, to your point earlier, Emmett, to systematically operate this thing, to put it out there. How does my front office need to change? Do we need to answer phones a little bit different? What does my billing need to change? How does my marketing need to change? What does my office manager need to do? All these little things, not to like paint the like doom and gloom picture, but like it's a small thing, just brick by brick, brick by brick, brick by brick. But if you don't have support and you don't have the systems already and you don't have support on getting those systems in place and you are on your own, that's not fun. And
it's
so,
true on any specialty. I'll see someone go, I'm going to add ortho, they go do the CE. But adding ortho isn't just the clinical output, it's the entire, again, logistical process that has to be figured out. So it would make sense that probably those stats are true with any kind of specialty component. doc goes out, does their CE, feels some level of baseline clinical capability, but then realizes everything is actually implemented from front desk, back. And without those systems in place, then you don't execute. I am curious as far as like outcome for those who do implement it. What are we talking about as far as ROI? I mean, not to jump to the end of the story, but if I just flip to the back of the book here, if someone from a financial perspective, more impact on patients and community, do you all have some stats on like, hey, our dentists who come in, who take our courses, who truly implement this, their practice goes from X to Y? And how do you guys think about that? Like, how do you measure financial success on
Sure.
this?
I think that's part of the, and Leah, correct me if I'm wrong, I think that's in the white paper that folks get when they listen to the podcast. I'm not exactly sure.
Okay, it'll be dropped
Yeah,
in there.
yeah. So yes, I right now, and Leah kind of update me if need be. Thank you. I want to say like the national average for a daily production is for a GP is about 5,000. By way, and we can get into why this makes sense and how it actually occurs, but broad brush, that jumps from 5,000 to about 11,000, maybe 9,000 to 11,000 in the first year of implementing IV sedation, and can go up to
More than doubles.
yeah,
Mm.
yeah.
Now,
And
according to ADA, just so you know, the average dentist does 700,000 a year, which comes out to about 60,000. So if they were working 5 days a week, it'd be even lower than that. But yeah,
yeah,
the fact that you're saying this opens up the opportunity for more treatment acceptance somewhere around doubling whatever you're doing is
that's initially,
incredible.
and it really
Yeah.
once you really get the and I'd love to kind of drill down and kind of pull back the curtain on how, but yeah, that's initially. Maybe it's not first 6 months. Nothing's like this. If you go in
Sure.
this, you're going to be negatively disappointed. So let's get an accurate expectation here. Within the first chapter of implementing it, you're going to get better and better and better and better. Soon enough, your numbers are going to rise and you're going to hit the double mark. A year later,
And your scope that you can handle also is increasing along the way. So you're going to be super picky in the beginning, really small scope. And then as you build on that, that probably also contributes to the outcomes there, right?
several of our precisely nail on the head. A lot of our doctors who've been doing this for a while get up in the nice like 20s every single day in production.
Mhm.
And that's that's great. And the reason why
What causes that? Yeah, you're going to say the reason why. What's the outcome of is that happening? Obviously, patient acceptance goes up because we just killed the fear factor, right?
it's acceptance. Yeah, I would say even more than that, it's the concept of value per appointment. And kind of like what you were saying a minute ago, initially, if you got your IV certification, you're going to wisely, please, I encourage you to start slow down, speed up. Safety, safety, safety. That's our beat. Initially, you're going to be looking at a very, a narrower column of, yes, this is my type of patient. I can service them appropriately. I feel competent and safe. Let's go. 6 months, you expand it. 9 months, you expand it. A year, 2 years, 3 years, 4 years, 5 years. So eventually, like you pointed out, you're going to be adding, you're going to say, be able to have a wide door to many more patients, say yes to many more patients who have been, and it always comes back to the patient. If they're the type of individual for any reason, fear, medical compromise, whatever, if they haven't been in the dentist for 5, 10, 15, 20, 25 years, what's that look like in them? It looks like I always say they box themselves into a life corner where now they don't get to think about fear. They don't want to think about anything else. They have to do it because they have to do it. They're not going to pay for that truck they're going to buy this year. They're not going to do X, Y, and Z. They're going to get this fixed, and they don't have a choice. And if you
That's an interesting part I hadn't thought about is this
Mhm.
50%, as we're calling it, that's been delaying it. The treatment planning on them is going to be more extensive, right? Because of the natural delay that's happened. And the fear factor is naturally even higher built in. So now you said they boxed themselves in the corner. They've been fearful. They now have more work to do than the typical individual. And so it's a compounding effect. And unless someone can bring in an agent that will smooth that out and allow for that to bridge over, then they're just going to continue down, that road, right?
Something,
Yeah, go ahead, Leah.
yeah, something else to add there. I mean, I think you naturally become a magnet for patients who have avoided the dentist. So they, you know, are going to be higher dollar value. That's not why you're doing it, but that's the circumstance.
Yeah.
On top of that, you know, to your point of the Amazon example, you remove friction for patients who are already in your patient base, because there maybe is a treatment plan you've had and you've been thinking, how do I navigate this conversation and convince them this is work? And are we going to wait until you have to have it done? Are we going to be a little more proactive because that could save this tooth, or whatever the case may be? And they might say it's money, or it's the time of having to sit in the chair and schedule out 5 different appointments. And if you could say, you know what, we can get it done, one fell swoop. Let's come. We'll knock it all out. You'll be knocked out. Well, you're going to feel better. You're going to get the smile you want. You just kind of remove the obstacles where people have reasons to say no. So it's very easy to say yes. And that exists within your current patient population, let alone attracting those who have really boxed themselves into a corner.
I wonder how many people say it's dollars, and, you know, the saying, price is an issue when value is not present. And is the value component the fear factor that's feeding into this, right? And so ironically, even if the sedation increased the price, the value is so dramatically different that price now isn't even actually the problem, and maybe never was. It was just like, do I want to pay to be in pain? No. Okay. You know, so
Exactly.
that's the challenge, right?
And like, and you were pointing out earlier, you know, like there's things are a given. Like you're supposed to be doing great dentistry. You're supposed to take care of me wonderfully. So like, yeah, and if they're, you know, looking at competitors and where to spend money, that's not an issue anymore. It's like, who's the one person that can help me? And if you got your hand up, then
at the lowest pain point. Yeah.
Yeah.
It's interesting. So how does it kind of work tactically? You know, let's say somebody's like, hey, this is really interesting. I want to explore this. What is the typical path for a clinician? And then it sounds like their team as well to build into, you know, and we're talking about doubling the revenue for your practice. Potentially, if you have associates, et cetera, I mean, now everybody's on a doubling path. Even if you got half that result and you increased 50%, you know, it'd be dramatic if you said, oh, I'm only going to work in a very narrow scope, right?
Sure.
So what does that journey look like typically?
Yeah, Leah, you want to take, I'm happy to.
Sure. Yeah. I'll start. I'm going to take one step back. I always like to go a little more upstream to get to where we are.
Sure.
So I think just to confirm that we're on the same page of like, who's the right match, who's a good fit, to know that this is, I mean, the thought of doubling production, tripling production, I'm sure many people's ears are peaked and they're saying, that sounds great, I want to do it. But when we get into what you have to do, it's not, you know, snap of the finger. So let's just make sure we're talking to the right folks, and either internally they can do this audit, or they have a buddy down the street and say, hey, this might be the right fit for you. But how would you even know that? So I think you want to start off by thinking through, what procedures are you currently offering? What would you like to offer? If you're already doing some really complex treatments, then you would be in the bucket of like IV sedation maybe makes sense. If you're not, but you want to, then you might say IV sedation makes sense because it's going to allow for that possibility.
And what would you consider complex? Like, what are typical things that like these start to become a no-brainer for?
Yeah, I mean, I think, you know, root canals, if you're doing implants, if you're doing more like surgical cases, the things that you would, if you're earlier in your career, referring out to, but you're starting to do that on your own, you know, those types of treatment plans. Clay, you want to?
It's interesting you say that. I remember when I was president of ADSO, I was talking to one of these billion-dollar DSO groups, and they were just talking through stats. And they said they had a big consulting firm come in and just look at all their data. And they said on their de novos, if they didn't do a certain amount of root canals within the first month, it changed the trajectory of the growth. And when they double clicked on the why, it was because the patient perceived the dental practice as not being able to get them out of pain, right? So we think of it as like, we do these treatments, we don't do these well, et cetera. From a patient perspective, it was like, I went in and they couldn't solve my pain point. They didn't think of it as, so they So the referrals went down versus someone who could do more complex things, who could remove pain from someone. And there wasn't a sedation component talked about in this, but I'm sure that would have been, 10x it. But then they just say, oh my gosh, I went in, I was in so much pain. No one's been able to solve this. I could imagine the compound. I just went to sleep. I woke up, boom, it was done. Right. That story like starts to take off like wildfire. So
I think we see that on the just, regular medical side as well. I mean, Clay and I, we are more the marketers. So we're patients both as dental patients and as regular medical patients. And it's very frustrating when you go to your GP and you say, I've got this problem. And they're like, I don't know, go see this person, go see this person. Right. You're at a point you start going to Google Doc to figure it out because you don't have the time to make all these appointments and have somebody else tell you that they don't know. So it is very reassuring and encouraging back to dentistry if you could have a dentist who can do it all. Again, with IV sedation, maybe not right at first, but if you're the type of dentist who wants to be more of a surgeon and really feel like you're a doctor of dental surgery, then IV sedation certainly is in the realm of possibility and probably the right fit.
So let's say I fall into that group and I'm like, yes, I'm definitely one who's done the CEs. I'm doing the more complex cases, or I want to. Then what's next?
Yeah. Clay, you want to talk about, maybe just walking through the program, what it would look like?
Yeah, I certainly can, but I want to, even before you do that, it's almost like, for me, it's like a two-sided coin of like, do I have clinical aptitude or appetite for this? Is kind of what Emma's outlining. Like, I've been to see, has been stacking up, this skill and that skill, and I can handle these types of treatments. And like, I feel compounded and my platform's really strong, strong foundation. That's number one. It's like, do I have the clinical inclination and kind of competence and confidence within myself to bite on it? Because it's something I can share. Number two is really like, I encourage people to think through what phase they are in their own career. Are they, fresh in the field? Are they mid-career? Are they trying to get out of the chair a little bit? Are they eyeing the retirement door? And got to be really honest with yourself about where you are and how you want to grow. And you probably know than anybody, there's a million ways to grow. You can grow by way of focusing, and like Dia is full of like people who are just like, they excel at business. They put the spotlight on the business, and there's ways to grow there. You cut this, you tighten that up, you excel this, put the pedal down, voila. So there's people that really kind of gravitate toward that, and there's people who gravitate toward growing by way of a clinical avenue. And this is very much, you have to be able to clear that particular hurdle. It is a full enchilada thing. It checks all the boxes: staff, retention, culture, patient care, dollars and cents, all the things are checks, but you have to enter through the door by clearing the hurdle of, am I clinically confident in biting on this? And if you clear that, then yeah, IV sedation could very well be a great way to start checking those boxes. Check, 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 check.
Cool.
With that said, like, I'm happy to kind of like,
Yeah. So yeah, let's say I'm interested. I want to start with myself. Maybe then I'll bring in my associates, but I want to, get myself there first. What does that look like? And what's the typical time frame? Yeah.
Yeah. Time frame. I would say, we say it, you can enter the process and get out with, around 6 months. I think that's a healthy, healthy ballpark, knowing that everybody's different and they should be different. If we're talking slow down to speed up, and if we're talking safety, focus on the patient first, then you should go at your own speed, and really be do those audits on yourself. How am I learning? Do I feel confident today? Am I ready to move on to the next step? With that kind of mental backdrop as as kind of the outlier here, I would actually put our eyes on like the end of the process first, and then I'm going to kind of walk us backwards from there, if that's okay. So people listening and watching might like a little lost, but I'm gonna start at the end of the process and work backwards. For us, the end of the process, and I would say, with all your IV sedation training programs that we encourage you to look at, please be aware of everything that's out there. It's going to end with a clinical, well, with us, it ends up with ongoing support, where we say, this is how we're doing it in our clinics. Here's this, mock drill to run through with your team. Here's all the support, blah, 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 blah. That's us. Before that, it's the clinical phase. For us, it is all about safety. It is all about slow down to speed up. It's about how can you get the most real world ready education in an environment that is going to resonate with you. So a lot of other programs, Zero Shade, everybody slices the cake a little bit different. It's going to be more of a hospital-like experience where you're kind of moving at a much higher clip. And that means being, doing a 15-minute case, a 15-minute case, a 15-minute case, a 15-minute case, and that in a hospital-like environment. And that's not exactly what folks are going to be doing in the real world in the field. So we want to drop them into one of our clinics where they are getting shoulder to shoulder, elbow to elbow, one-on-one mentorship from a seasoned expert doc who's been doing this for a long time and know what the real world is actually like. Who knows what it's going to be like when you have not a 15-minute case every single second. You're going to have an hour-long case. You're going to have an hour and 15. And eventually you're going to work up to a 2-hour case. And then in a few years, maybe you can bite off something, and we're going to show you the whole cross section and kind of walk you through and let you kind of like kind of seep and marinate in the in the juices of what that is every day in a real life working high a well-oiled clinical environment. And
part of the competitive advantage you guys are bringing is some training programs are like, here's what you need to do to check off the boxes and be sedation certified. You guys have said that's true. However, it's not as complementary to what's actually happening. And so we feel like it's better if we just mimicked real life so that your training matched your reality. Is that part of what I'm hearing?
It's a great outline. And I'd actually say, knowing that as well, we tell all of our graduates, every state has, their state requirements to get X number of patient cases and go report to the board and, submit and all that stuff. Most states are about 20 cases, and there's a few outliers. Indiana, for instance, is 10. What we tell our graduates is like, listen, you might have hit your quota and you might have hit your 20 and you're going to move on. If, however, you'd like to come back and get 10 more, 5 more, 20 more, we're still doing this every day, all day, every day. No charge, come on back. We want you feeling safe. We want you feeling confident. And that's where the rubber meets the road for us, is like, we want our graduates to get it, and not only get it here and here, but get it operationally and implementally, it's not a word, to go out and not be part of the 86% and let it wither on the vine. We want them to get it here, and go do it and stay with them until they keep on coming back to the well, keep on drinking, keep on talking to our faculty, keep on using these documents we've got until finally it's 2 years and you're actually doing it. You don't need us no more. What a wonderful feeling. That's what we want to create. I see you nodding. Do you have anything to add on top of that?
Yeah, no, I think that's accurate. I mean, there's state by state requirements, but generally speaking, it's X number of didactic training hours and 20 patient cases. I mean, getting it down to the basics, that's kind of what it is. So for somebody who's
those could be 15-minute cases, or those could be hour cases.
Yeah,
that's
the
not
thing.
regulated, and that's where you guys feel that there's a difference in what you're doing there.
That's a huge differentiator, especially if you're doing yours in what feels more of like a hospital or a surgical center where you just have patients coming in. That is not going to mimic your real life experience. And so sedation done safely can feel safer than regular dentistry because the drugs are titratable and reversible. If you're doing a 15-minute case, though, you're not even seeing what that looks like. And on one hand, when you get going, maybe those are the cases you should do. But I think it's also important for your training to know what the spectrum is and to understand what does it look like to have a longer case? How do I manage that individually as the dentist? What does it look like for my staff to be managing that? So inside Advanced Dentistry, you see what it looks like to really put it up on its feet. And we encourage you to bring your dental assistant so they can get that training too. And like Clay said, 20 is the benchmark, and 20, what we've seen for the most part, 20 is enough. But if anybody would ever want to come back, that door is open and you are very much encouraged to come back. And I think, again, removing barriers to get going, we can show you the wonderful clinic that is Advanced Dentistry, and it's really invigorating, exciting to get compliments of, wow, this operates so smooth, and then have a recognition you're not going to be able to go do that right away. But what are ways that we can, again, remove obstacles? So one way is that, we have a partnership to get you a sedation starter kit. So we've got the list of drugs that you're going to need, the equipment that you're going to need, and at a discounted rate, get you going in your office. And certain other things, we're inviting feedback from graduates to say, like, what else do you want? We want to make this conducive for you. At first, it's maybe just help with getting the application complete for your state. Great. Like, don't let that be a barrier. There's a lot of things that you need to track down. We're here to help. Then it's how do I get it up in my office, from equipment to, like Clay said, it might be, the marketing. I mean, all those things aren't necessarily built out just yet. We don't want to lead you astray, but it exists because it exists at Advanced Dentistry. So it's all within our grasp. And when somebody asks, we can go track it down. So I think the biggest differentiator is that we are really focused on a high quality delivery and being a small, nimble team that can do that.
We have several DEO members who've been through this program, and it's been amazing, and so that's part of why we wanted to bring you on, just because with 400 organizations, we're coaching now 3 billion in revenue. So we get to kind of see where the market's at on certain things. And this one's been really interesting to us. It's not that, 400 members are doing it. There's a handful, but those who are definitely leading in a lot of areas. And what's cool there is, I think that this relationship with you all have some incredible training, both on the clinical and it sounds like on the team side. And then also within DEO, our members who are executing, the teams are talking to each other to continue to build out best practices. So that's a nice synergy that's happening. If they are having, trouble just with like phone answering or what scripting I should say, et cetera, it sounds like with having the Advanced Dentistry, 4 practices already executing on this, you all can say, here's the script we use, here's the checklist, those kind of things, which is huge. That's a lot different than most just like clinical CEs. This is really an implementation program as well. So it's awesome.
Yep. Well said.
Awesome. So, what would be next steps if somebody's interested in like, okay, I get it. I get the vision. I get that I could have bigger impact on my community.
Yeah.
I could really differentiate myself. I could really serve people who have a lot of fear. I could also look at my own book of unscheduled treatment and be a little bit more honest about like why they might not be coming in, right? And that adding something in. So if I have that appetite and I wanted to move forward, reach out to y'all, what would be the best way to contact you and to just get started and just kind of find if it's the right fit for me or not?
Yeah. Honestly, I would say it's very simple. We want to, like Leah saying earlier, remove as many hurdles and, obstacles as possible. VesperInstitute.com. That's Vesper with a V, like Victor, VesperInstitute.com. On there, you'll find all sorts of forms. Just send in a form. For us, we are a no sales team. We're not going to try to sell you. I firmly believe, in Leah as well, you have to naturally and genuinely want to do this. So for us, the first thing is it's a matching conversation. I'll call it that. Is like, hey, let us hear a little bit about where you're at, clinically, careerly, and what about this kind of reaches out to you. Okay, great. It sounds to us like you actually might be a good fit. Let's kind of move on to the second date, and kind of, again, slow down and speed up. That's really where safety is a mindset, and mindsets populate everything you do, and they show up in everything you do. So for us, if we're honoring that, we're going to kind of slow down and date a little bit. I'm not going to like hold anybody off and do the Heisman, but it's not like, hey, give us your money. that's not,
it's really right fit. And what's the frequency of some of these classes or getting started? Like if I said, I've been looking at this, been looking for a good solution. I want to start sooner than later. Is there some kind of cohort cadence, or is it monthly, or what is it?
Yeah, we're gearing up to, it's going to be quarterly, I believe, in 2026. This year, we're gearing up there, again, slowing down, making sure everything we say we can do and we can deliver and really help our graduates as nimbly and as effectively as we can actually do it in real life. Very important to us. So this year we've got I think there's spots still open in our July cohort, and there are spots still open in our October cohort. And then we're going to move on to 2026. So
Awesome.
if you're thinking about it, there is plenty of homework to do beforehand. It's a commitment, and it should be. It has to be something that's genuine to you. You got to want to do it, and you got to commit to it because it's real deal stuff. So there's some homework to do. So if you're thinking about July or October, go ahead and give Leah and Clay a holler and we'll go from there.
It's awesome. Thank you guys so much for all this information. At the end of the day, anytime we can find individuals who are helping us take care of the patients better, helping us retain team members better, and helping the practice to grow, it's a great combo. So appreciate everything that you guys have talked through here. Awesome resource. Reach out to Vesper. For those who are interested in DEO, go to deodentalgroup.com. You'll see here, if you're on the YouTube here, we've got our summit coming up. That is for members only, but absolutely awesome. We're going to be talking through the labor codes for practices at different levels, break out into our tribes and our masterminds, some great keynote speakers, and Vesper will be there. So you'll be able to connect with them as well and dig into more info, but you can go to DEO Dental Group and have a growth accelerator call and talk to one of our team members there. Thank you all so much again. And to our listeners, keep smiling.